Science, Space, and Technology will come to order. Without objection, the chair is authorized to declare recesses of the committee at any time. Pursuant to Committee Rule 2E and House Rule 11-2H4, the chair announces that he may postpone roll call votes. Today we meet to consider H.R. 4675, the Low-Dose Radiation Research Act of 2017. Pursuant to notice, I now call up H.R. 4675, the Low-Dose Radiation Research Act of 2017, and the clerk will report the bill.
H.R. 4675, a bill to amend the Energy Policy Act of 2005 to provide for a low-dose radiation basic research program.
Without objection, the bill is considered as read and open for amendment at any point, and I'll recognize myself for an opening statement. H.R. 4675, the Low-Dose Radiation Research Act of 2017, is bipartisan legislation and was introduced by Representatives Roger Marshall, Dan Lipinski, Randy Weber, and myself. It authorizes a revitalized low-dose radiation research program within the Biological and Environmental Research Division of the Department of Energy's Office of Science. This research program is part of the Science Committee's continued effort to ensure America remains a leader in basic research and innovation. H.R. 4675 directs DOE to identify ongoing challenges in low-dose radiation science and develop a long-term basic research plan that addresses these challenges. It also directs the Department to engage with other federal agencies and the international research community to develop the basic research program. This program will analyze any unknown health impacts of low levels of radiation, providing critical knowledge to our nation's researchers, industry, healthcare community, and military as they handle nuclear material, maintain the nation's nuclear weapons program, provide medical treatment, and dispose of nuclear waste. Low-dose radiation research can also inform regulatory agencies that set nuclear safety standards for the public, including enabling federal emergency response agencies to more accurately set areas of evacuation for a radiological incident like a nuclear power plant meltdown. This research is also of particular importance to practicing physicians who rely on thorough knowledge of radiation health risk to decide when and how to use life-saving diagnostics to detect and treat cancer in patients. In the last Congress, this committee explored DOE's ill-advised decision to terminate its low-dose radiation research program, which, until its closure in 2016, was one of the largest and most effective programs of its kind in the world. With so many questions left unanswered about the science of low-dose radiation, it is no surprise that closure of this crucial basic research program was opposed by the scientific community. In a hearing last fall, the Science Committee heard from witnesses who strongly supported reprioritizing low-dose radiation research at DOE. This legislation has received letters of support from the Health Physics Society, the American Association of Physicists in Medicine, the National Council on Radiation Protection and Measurements, and leading researchers from Northwestern University and Columbia University. Congress must reprioritize basic research in low-dose radiation so we know we are using the best available science to serve and maximize our nation's energy, medical, and defense needs. Again, I thank the bill's primary sponsors, Representative Marshall, Ranking Member Lipinski, and Chairman Weber, for their initiative on this issue, and I urge my colleagues on the committee to support this legislation. The gentlewoman from Texas, Eddie Bernice Johnson, the Ranking Member, is recognized for her opening statement.
Thank you very much, Chairman Smith, for holding today's markup of H.R. 4675. The Low-Dose Radiation Research Program Act of 2017. This research is important to better understand the health impacts of exposure to low dosages of radiation that could result from medical tests, terrorism, events, or materials associated with nuclear weapons and power production. Since its inception in 1998, the Low-Dose Radiation Research Program at the Department of Energy had provided high-value scientific data to help determine these risks. However, its funding levels have been cut since 2012 as the Obama administration informally expressed its intention to end the program, and it was finally terminated last year. And thus far, the Trump administration has not indicated any interest in restoring DOE's stewardship of these activities. In November, GAO provided testimony before this committee as a recent report which recommended that DOE lead the development of a plan for interagency collaboration on research into low-dose radiation's health effects, citing a lack of coordination efforts among federal agencies after the department began phasing out this program. I believe that this bipartisan bill reflects GOA's findings and recommendations, and I have sponsored and supported similar legislative language in the past Congresses. Therefore, I am pleased to support H.R. 4675 as well, and look forward to working with my colleagues on both sides of the aisle as well as the administration to restore the U.S. scientific leadership in this critical area. Thanks, and yield back the balance of my time.
Yeah. Thank you, Ms. Johnson. And the bill's sponsor, the gentleman from Kansas, Dr. Marshall, is recognized for his opening statement.
Good morning, and thank you, Chairman Smith, for the opportunity to speak on behalf of this important legislation. I would also like to thank the chairman, as well as Representatives Dan Lipinski and Randy Weber, for co-sponsoring H.R. 4675, the Low-Dose Radiation Research Act of 2017. I'm grateful for their leadership and their commitment to biological and environmental science research, and truly blessed to work alongside the members of this committee that have supported initiatives in basic science research to keep America safe and globally competitive. The Low-Dose Radiation Research Act of 2017 requires the Department of Energy to carry out a research program on low-dose radiation within the Office of Science. The bill directs the Department of Energy to work with key federal agencies and research communities to develop a long-term strategic research plan. This program will increase our understanding of the health effects that low doses of ionizing radiation have on biological systems. Every day, humans are exposed to low doses of radiation. It's the product of industrial activities, commercial processes, medical procedures, and naturally occurring systems. Research has consistently shown us the adverse health effects associated with high doses of radiation, but the health risks associated with exposure to low doses of radiation are much more difficult to observe, and we are a long way from understanding and accurately assessing those risks. In the absence of conclusive evidence, agencies like the Department of Energy, the Food and Drug Administration, and the Environmental Protection Agency are obligated to assume that any exposure to radiation increases the risk of harmful health effects. Without proper research, agencies have no way to measure if there is a safe radiation threshold. Our restricted understanding of low-dose radiation health risks directly impacts our ability to address potential radiological effects and medically based radiation exposures. It may also result in overly stringent regulatory standards, inhibiting the development of nuclear energy opportunities and posing an undue economic burden on the American people. As a physician in my home state of Kansas, I've had a firsthand understanding of the crucial importance of verified research in ensuring the best medical outcomes for my patients. For instance, an adult patient who receives a commuted tomography or CT scan of the torso is exposed to approximately 3 years' worth of background radiation at once. The CT scan is an invaluable diagnostic tool, replacing many invasive surgical procedures, and is a medical necessity for countless Americans. Today, we physicians are unable to inform our patients of the specific health risk with these types of vital imaging processes. There is a broad consensus among the radiobiology community that more research is necessary for federal agencies, physicians, and related experts to make better informed decisions regarding these risks. It is no surprise that H.R. 4675 has received support from the Health Physics Society, the American Association of Physicists in Medicine, the National Council on Radiation Protection and Measurements, and leading researchers from Northwestern University and Columbia University. Once again, I'd like to thank Representative Dan Lipinski, Chairman Lamar Smith, and Energy Subcommittee Chairman Randy Weber for co-sponsoring this important legislation. I encourage my colleagues to support this bill, and I yield back the balance of my time.
Thank you, Mr. Marshall. And the gentleman from Illinois, the ranking member of the Research and Technology Subcommittee and the other lead sponsor of this legislation, is recognized.
Thank you, Mr. Chairman. I want to thank you and want to concur with your comments and Ranking Member Johnson's comments, and want to thank Mr. Marshall for introducing this bill, and I'm pleased to join him as the lead Democratic co-sponsor of this bill. Low-dose radiation research is a critical field that can provide important insights into the biological response of cells to low levels of ionizing radiation. This research has obvious potential impacts in the field of diagnostic medicine, but it will also provide crucial information for the nuclear energy industry, environmental cleanup operations, and our national security. Almost 20 years ago, the Department of Energy began funding research into low-dose radiation. During the program's history, DOE's research resulted in a number of important advancements in our understanding of cellular response to radiation exposure. However, during the Obama administration, officials at the Department of Energy decided that this work was no longer a priority and proposed to ramp down funding and eventually eliminate this work. Appropriators followed this recommendation, and without a statutory authorization in place, the low-dose radiation research program was eliminated. The current administration did not propose new funding for this research in fiscal year 2018 in their budget request, and we do not expect anything different in the budget proposal we'll see for 2019. The process by which the low-dose radiation research program was eliminated underscores the importance of this bill. As an authorizing committee, it is crucial that we hear from the experts, consider the body of evidence, and determine the priorities of the agencies that are under our jurisdiction. That is our job. In the last several years, a variety of stakeholders, as well as the Government Accountability Office, have weighed in on the need for this research. And our committee has heard the same in 2 hearings on this topic in the last 2 years. That's why I'm happy to serve as the lead Democratic co-sponsor of this small but very important research bill. I'm hopeful that during the next several months we can follow the model we followed on this bill and pass other well-vetted bipartisan bills out of this committee. I encourage my colleague to support the bill and such continued efforts. And thank you, Mr. Chairman, and I yield back.
Thank you, Mr. Lipinski, and the gentleman from Florida, Mr. Dunn, is recognized.
Thank you very much, Mr. Chairman and Ranking Member Johnson. I want to thank all of you for convening this meeting to take under consideration H.R. 4675, the Low-Dose Radiation Research Act of 2017. I also want to congratulate my classmate and my friend, Dr. Marshall, and his co-sponsor, Mr. Lipinski, for investing the time to produce this bill. During the committee's hearing on the subject, Dr. Brink from the American College of Radiology testified that more than 1 million patients a year receive the benefits of radiation treatment, which include extended life and relief from pain and suffering. Improving our scientific understanding of the effects of exposure to low-dose radiation will accelerate development of advanced diagnostic and therapeutic procedures and enhance the acceptance of controlled use of radiation among patients and doctors, which will improve the quality of care and save lives. It is legislation like 4675 that makes me optimistic for my children and my grandchildren's future, and why I'm honored to serve on this committee with all of you. Thank you, Mr. Chairman.
Thank you, Mr. Dunn. If there's no further discussion, we will go to amendments, and I'm aware of 2, both to be offered by Mr. Foster, and he is recognized for the purpose of offering the first one.
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk will report the amendment.
Amendment to H.R. 4675, offered by Mr. Foster of Illinois, amendment number 74.
Without objection, the amendment is considered as read, and the gentleman from Illinois is recognized to explain his amendment.
Thank you. My amendment would simply direct the Secretary to identify and, to the extent possible, to quantify the potential benefits to stakeholders of the low-dose radiation research program and different components of it. The research that comes out of this program will have a number of uses across several agencies and sectors, including the private sector and the public at large. For instance, if we learn that astronauts could be safely exposed to slightly higher levels of radiation, this could have potential cost-saving implications for manned spaceship design, or the reverse is possible. To the extent that medical treatment and diagnosis represents a trade-off between radiation and health benefits, then we can get to a more science-based position there. Environmental remediation, from radon in basements to the cleanup of legacy sites, legacy weapon sites, to the safety of nuclear workers, are other important examples where you have to make sure that the research you're doing matches the actual application in the real world. So an effort to quantify, to the extent possible, these potential benefits is essential to ensuring that the low-dose radiation program properly prioritizes questions with the greatest real-world impact. The funding that we all hope will become available for this program will not be infinite, and it's important that when the program's restarted, that it is restarted especially in the areas that will really, make the world a safer and less expensive place to live in. So I'm pleased to see such strong bipartisan support and join with my colleagues in supporting the reinstatement of a low-dose radiation research program at DOE. I believe that my amendment will help ensure not only the best use of DOE's limited resources, but also the long-term success of the low-dose radiation research program. I understand that the chairman supports this amendment and will accept it, so I'd like to thank him and Ranking Member Johnson for their support and yield back the balance of my time.
Thank you, Mr. Foster. You're correct. I'll recognize myself in support of the amendment. The amendment would add a requirement that the Secretary of Energy identify potential monetary and health-related benefits that could occur through the results of the research program authorized in this legislation. So this is a common-sense amendment that seeks to show the value of continued investments in basic research, like the low-dose radiation research program. I encourage members to support the amendment. Is there any further discussion on the amendment? The ranking member, Ms. Johnson, is recognized.
I'd like to move to strike the last word.
The gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. I support this amendment and appreciate Dr. Foster's work to improve the legislation we're considering today. As we heard during the committee hearing that took place in November, research into low-dose radiation can have far-reaching impacts in a variety of industries and disciplines. One of the key takeaways from that hearing is that the economic and health benefits from this research are likely numerous but unknown. I support this important addition to the program's scope, directing the department to consider the potential benefits to key stakeholders in government, academia, and private industry, would provide helpful guidance to the program and would ensure that the benefits of the research are well recognized. And I encourage my colleagues to join me in supporting the amendments, and I yield back.
Thank you, Ms. Johnson. If there's no further discussion, the question is on agreeing to the amendment. All in favor say aye. Aye. Opposed, no. The amendment is agreed to, and the gentleman is recognized for the purposes of offering the next amendment.
Thank you, Mr. Chairman. I have another amendment at the desk.
The clerk will report the amendment.
Amendment to H.R. 4675, offered by Mr. Foster of Illinois, amendment number 72.
And with that objection, the amendment is considered as read, and the gentleman continues to be recognized.
Thank you, Chairman Smith. A few months ago, we held a subcommittee hearing on the low-dose radiation research program at the Department of Energy. It was a very productive and bipartisan discussion, although I remain disappointed that no one from the Department of Energy was there to participate. I join with my Republican colleagues in supporting the reinstatement of the low-dose radiation research program at DOE. I appreciate that this bill acknowledges the need to formulate scientific goals for the low-dose program, and that it instructs the Secretary to consult with and engage with other federal agencies. I believe this is key to ensuring the success of a renewed effort on low-dose radiation. And given the bipartisan support for this program, however, I was disappointed to see that the underlying bill expects the Department of Energy to start this new research program with no new funding. You know, it seems as though we used to have a bipartisan agreement in Congress that when we asked the government to spend more money, that we would actually specify how to pay for it rather than pushing the debt onto our children. But it appears in recent times that that bipartisan agreement seems to have vanished. So my amendment today simply corrects this by increasing the authorization for the BER program by the amount dictated in the underlying bill. It's irresponsible, I believe, to direct DOE to undertake new research, a new research program with no new funding, and that would inevitably mean that another valuable area of research within BER would suffer. Now, I understand the chair is opposed to the amendment, and as a courtesy to him, I will be withdrawing it. But I do hope to work with my Republican colleagues to increase funding for the BER program so that the low-dose radiation program can be properly funded. Thank you, and I withdraw this amendment.
Okay. Without objection, the amendment is withdrawn. I thank the gentleman from Illinois for his thoughtful comments, and we'll continue to work with him on the program. Is there any further discussion or any more amendments to be offered? And if not, reporting quorum being present, I move that the Committee on Science, Space, and Technology report H.R. 4675 to the House as amended with the recommendation that the bill be approved. The question is on favorably reporting H.R. 4675 to the House as amended. All those in favor say aye. Opposed, nay. The ayes have it, and the bill is ordered reported favorably. Without objection, the motion to reconsider is laid upon the table, and H.R. 4675 is ordered reported to the House. I ask unanimous consent that staff be authorized to make any necessary technical conforming changes, and without objection, so ordered. If there's no further discussion, that completes our business. This concludes the Science Committee markup, and without objection, we stand adjourned, but I also want to thank all the members who came today to this markup. It wasn't expected to be long, but I always appreciate their presence. We have 3 doctors present on our side, all of whom will have a special interest in this bill as well, as does the gentleman from Illinois who has the PhD in physics. So we stand adjourned.